So Tracey Crouch, thank you very much for joining us. So you've just finished quite recently, I think, your treatment for breast cancer. How are you doing?
Really well, thank you. I've been really lucky throughout my treatment, which included chemotherapy as well as radiotherapy, that my side effects have been quite limited. So I've managed to carry on working throughout. I've managed to carry on doing some form of exercise throughout my entire treatment, and now just kind of getting on with it, really.
So I know that you are very passionate about sports. I think our sporting kind of prowess differs. You're a very, very keen footballer, a very good footballer, I hear. And one of the things I liked hearing most about you is that you're the first female player on the MP's football team, which made me chuckle. So you said you did manage to stay active during your cancer treatment. How did you do that? And did you find it helpful?
I did. I mean, I haven't played football for a while. In fact, I haven't played football since diagnosis because the football team's in London and I live in Kent. So I've kind of been locked down in Kent for since June last year. But you know, I've kept myself active throughout, whether that's going either out on the bike, or I've got a turbo trainer which I hook the bike up to and so can cycle indoors, or even just going for a walk. I've managed to keep going. My own oncologist is a real passionate believer in the power of exercise, and he follows me on Strava. So I kind of felt that he was watching to see whether or not I was actually staying fit. And I remember him saying in one of the pre-chemo conversations that we had that there had been some studies that showed that patients who did exercise 45 minutes before having chemotherapy had fewer side effects. And so it's about a 45-minute walk from my house to the hospital. So out of the 8 chemo sessions, I managed to walk for 6 of them. Unfortunately, the last chemo session, it was absolutely hammering it down with the rain. And one was just actually because I practical reasons. But and it was right. I mean, I didn't suffer any poor side effects. And so I kind of, my head seems to think that he was probably right about it.
So is that something that you asked him about, or did he bring that up himself?
So, I mean, he knew that I was the former sports minister.
Yeah.
So, you know, he already knew that I like a lot of exercise and that I'm a believer in good physical health. He knew that I was already quite sporty, and we share a passion in cycling. So, so we were having conversations about it. I remember asking him specifically about 2 things, actually, physical exercise and nutrition. Now, physical exercise he was able to help with, nutrition less so. Unfortunately, nutrition is still kind of an area where I think there's a big gap in kind of understanding, and, you know, and certainly it's very difficult to find people who are perhaps experts in post-cancer nutrition, and whereas exercise is something that a lot of studies have been done, and a lot of oncologists are interested in it. And so, you know, I think that we were able to have a conversation about it in a more kind of factual way.
That's really good to hear, because it's one of our biggest barriers at the moment, is that a lot of people, a lot of healthcare professionals who don't practice exercise themselves don't bring that up with patients, and don't feel able sometimes to bring it up with patients. So yeah, that's really positive. It's something that I feel can make I guess it can give you back a sense of control in some ways.
Yeah, I think so. We know that exercise is good for our mental well-being as well as our physical well-being. So actually, sometimes going for a walk, even if I felt a bit grotty, was a way of getting outside. It was a way of keeping myself sane. You know, I mean, I think going through cancer is quite an isolating experience. Now, doing that during lockdown as well, I think, well, there are pros and cons. I mean, actually, in many respects, I didn't feel so isolated because everybody was in lockdown. So I wasn't really missing out on anything.
No FOMO.
Yeah, exactly. I had no FOMO at all. And actually people weren't watching to see, how much engagement I was doing with work, because we were all stuck at home doing, parliamentary business virtually anyway. So, so there was less pressure in that sense. But you are obviously shielding, your immune system is less. And again, we know that exercise can boost your immune system, fresh air boosts your immune system. And so actually getting out and doing something was both good for my physical health and my mental health.
So I've heard you talk a lot about mental health and general well-being, and it's something that I'm really passionate about, and something that 5K You Won't Move charity is trying to work on. And I think you've spoken about how you use mindfulness and meditation to optimize your mental health at times. How do you think that we can help encourage those diagnosed with cancer or any long-term health condition to employ both physical strategies such as moving and exercise, and also psychological strategies like mindfulness or what other strategies people might find helpful to make their experience more manageable? Because I don't think it's something we do very well in the NHS.
No, I agree with you, actually. And I remember when we were doing the sports strategy, which I was in charge of back in 2015, we were actually finding it quite difficult to engage with staff within the NHS, because obviously the NHS tells you to be healthy and fit, and yet we don't give staff members in the NHS opportunities to find their own sort of kind of place in health and well-being. And we were talking to occupational health within the NHS as to should there be lunchtime classes and things like that. But of course, saying things like that from me, from a professional perspective, doesn't
you need a lunchtime to do it.
Well, exactly, that's the point. You don't have lunch breaks. You have you snatch sandwiches and that's it. And so it is really difficult. But I think there's, in answer to your question, I think there's several things. I mean, first of all, I think if you're already fit and healthy, when you're diagnosed with cancer, the one thing that you think about is, can I still continue to do exercise? I mean, it was almost one of my first questions of, will I be able to still go out cycling? Will I still be able to do the things that I love? And you are a bit frightened, because obviously you have in your mind an image of somebody who's going through cancer, of being weak and weary and pale and drawn. And of course, some people are and other people are not. But you never see the other people. And so, so it is a kind of like saying to those people, you will be able to maintain some, if not all of your lifestyle, albeit dotted around the appointments of, for treatment, but also a few days after for some of the effects of treatment. And don't push yourself, but also don't do nothing. And I think those messages aren't necessarily and automatically told to people. And so, there are people who perhaps have been particularly fit and healthy in the past who suddenly get a diagnosis of cancer and stop. And that's not a good place to be. But then likewise, there are people who get diagnosed with cancer who are not perhaps in a physical activity routine. They don't go out twice a week for a run or whatever, who could benefit from being told that actually physical activity will reduce some of your side effects. They will help you feel better. They will put you in a better frame of mind mentally. If you can set yourself small challenges, even if it's a challenge of walking around the block, 3 days after treatment, that will make you feel like you've achieved something, and it's good for your health all round. So, but I don't think we automatically tell people that. You sit down and as an oncologist and you go through all the leaflets that tell you that you're going to, potentially lose your hair, that you're going to get mouth ulcers, that you're going to lose your sense of taste and so on. But all these ghastly things, but you don't actually tell people. Not you, Lucy, but don't necessarily tell people that you can still do exercise and you should still do exercise.
And something I see quite often actually is that when someone is diagnosed, their loved one, their partner, whoever is most close to them, what they want to do is wrap their loved one in cotton wool, and they want to do everything. They want to make them cups of tea. They want you to rest on the sofa. And actually, just sometimes all we need to do is give people permission that it is okay to get out for walks. And particularly, I think over the last year with COVID and shielding and all of that going on in the background, people with cancer, a lot of people with cancer have been too scared to do anything, to leave their house at all. And sometimes it is just as simple as giving people permission.
I think that's true, and I think that's a really good point. I actually think cancer is harder for the loved one than it is for the sufferer, because we as sufferers of cancer sort of kind of tend to put on this practical mind about, right, this is what it is, and we're going to do A, B, C, and we're going to do what the oncologist tells us to do, and so on. Actually, I sometimes think it's harder for our loved ones because they are not, especially during lockdown, they haven't been in appointments, so they can't hear all the things the oncologist is saying. They can't hear all the positives. Our own reflection of those meetings can sometimes just dwell on the negatives, and so on. So, I do think it's challenging. But my other half's come out for walks with me. He has said things like, don't go too far on your bike. I'm like, it's fine. I'm only going up to, Rochester and back. And he's like, yes, but that's 20K. And I'm like, well, that's, it's half what I would normally do. So don't worry. But, I can understand why people get worried. And again, it's about the general fear and sometimes, misperception of cancer as well.
And there is, like you say, there is this stereotype, isn't there? The stereotype person with cancer doesn't have hair. They're, on television, you never portray someone with advanced cancer going out living a normal life because it's not good television. So we all have these preconceived ideas that may or may not be right, and everyone's cancer is very different, and everyone's treatment is very different. And I think people like you and increasingly now in the media, there are more people living their best lives with, even with very advanced cancer, getting out there and saying, look, I've got cancer, but you wouldn't know to look at me. I look completely like anybody else that you bump into in the supermarket.
Yeah, I think that's true. I mean, there were moments where I thought, oh my God, I do look like I've got cancer, when my eyebrows and my eyelashes fell out along with my hair. And I remember walking in a chemo session. I remember walking to the toilet with the IV drip and thinking, right, that's it. I am currently looking like a cancer patient. And then you sort of kind of slap yourself around the face and saying, well, so what? You have cancer. But at the same time, it's not about necessarily look, and I've actually found losing my hair quite liberating, and it's growing back quite quickly now anyway. I quite like the buzz cut. I think I might keep it. But it's just lifestyle as much as anything. I already thought I was quite healthy, but even so, I've changed quite a lot of my general lifestyle, including what I'm eating, what I'm drinking. My stress levels are much lower, and I'm not sweating about lots of different things that in the past I would have been stressed about, and now I'm just like, oh, there's no point getting stressed about that. So I think it does change your outlook on life, and it certainly makes it certainly made me want to do more in terms of challenging myself. I want to see more places. I want to do more things. I don't mind sitting at home and wasting a Saturday in my pajamas if it's raining, but if it's not raining, I want to get out and I want to do stuff.
So that was something I was going to ask later on. So often, I think, in my experience, when people, sometimes even when they think they've got cancer and then they turn out that they don't, they're for that short period where they believe that they've got cancer and they face up to their own mortality, that makes them reevaluate what's important to them, who's important to them. And I like to think that COVID's actually given everybody this circuit breaker, and it is an opportunity to really take a step back and think, well, what do I want to keep in my life when life gets back to normal? and what do I want to take away? Who does make me happy? What does make me happy? It sounds like you've had that to some extent. Do you think there is hope from COVID giving the whole population that opportunity, or do you think we'll all just get back to normal and, you know, carry on as we always have done?
No, I mean, I hope that it has given everybody that opportunity to reassess, reevaluate what is important in their lives. And, you know, I think you're right in terms of when you're diagnosed with a disease, it doesn't have to be cancer. It can be sort of kind of other diseases that could be life-threatening if not treated quickly and
Yeah.
enough. I think it does make you kind of reassess what is important. And it gives you a certain amount of wisdom as well about, you know, things that you can pass on to other people. I mean, I'm immensely annoyed with myself that I never sorted out life insurance, for example. And, you know, I mean, why should I? I was at the time 44, fit, healthy, in a fairly secure job, and just like, why would I need life insurance? You know, the mortgage is covered if I cark it, so, you know, what's the point? And then you sit there thinking, oh, wish I'd got my life insurance, because of course now all my premiums, if I do get any, are just going to be ridiculous. So I think it does give you an opportunity to reassess your life. I mean, another personal example for me, the first lockdown actually helped with this, and this was pre-diagnosis, but I feel it even more now post-diagnosis. Being an MP means that you're taken away from your family for 4 days a week. So, you know, pre-COVID, I would leave work I'd leave the house on a Monday and I wouldn't come home until a Thursday.
And you've got a little boy, haven't you?
Yeah. And he was born into that. So, you know, Freddie was born into that lifestyle. He's completely chilled about it. The longest time I'd spent at home with him was my 10 or 11 weeks maternity leave. The rest of his life has been with me leaving on a Monday and coming back on a Thursday. Then all of a sudden lockdown comes. We have 12 weeks at home. That's the longest I've spent in his life at home. And I actually really enjoyed it. I really enjoyed sort of kind of putting him to bed and, you know, bathing him and giving him stories, which of course I was still doing 4 nights a week, but, you know, you sort of kind of didn't realize how much you miss the other 3 days. And then diagnosis came in June, and I haven't been to London since June. And all of a sudden it's sort of kind of like, okay, I love my job and I have no intention of quitting it, but there is a case of, can I rebalance it? So actually I can be home more often, you know, than I was before. And so you sort of kind of begin to think of alternative ways of working. And I, you know, with the way COVID has impacted parliamentary business and allowing us to participate virtually and allowing us to have proxy votes and things like that, is this something that, if we want to be a bit more family friendly, if we want to be a bit more women friendly, could we, you know, do something like this going forward? So I think both COVID and cancer has helped me kind of think there might be different ways of people becoming parliamentarians and allowing us to have a proper work-life balance.
And do you think that might mean that more women go into more women with families find it easier to go into politics?
Yeah, well, certainly people shouldn't feel, because what happens is people get elected to Parliament, sometimes unexpectedly get elected to Parliament, and of course, you know, the vast majority of MPs are not based in London. Their families are not based in London.
Yeah.
And so it's not just women, actually. You know, men feel it as well. My male colleagues feel it well. It is a wrench to leave home. But you know what you're signing up for, and therefore you just get on with it. But it is hard. And I think that the fact that it is so hard does increase stress levels, both at work, where you are, you know, pained that you're missing your family, but also when you get home, because actually the job doesn't stop when you get home. And therefore you then have this kind of issue if you're trying to balance work with home life. And actually what you want to be able to do is come home, switch off the phone, switch off the laptop, and concentrate on being at home. And being an MP just doesn't work like that. So I think that we have with things, us being capable of working from home, like every other, with other professions, I think we can perhaps allow, a bit more freedom, a bit more flexibility going forward. And I think that will help younger people, not just women, but younger people with families who want to do something like become a politician, get involved.
Because you were the first Conservative minister to have maternity leave, is that right?
I was. I mean, there had been other Conservative MPs who'd had babies and had been on maternity leave, but I was the first minister. I wasn't the first Conservative minister. I wasn't the first minister. Labour obviously had many female ministers in the 1997 to 2010 era, and they had children while in office. But I think the 2010 election brought in a lot younger cohort of women into the Conservative Party, and therefore it was only a matter of time before one of us ended up having a baby while in ministerial office. So yeah, I was the first Conservative minister. It worked very well. I mean, I have no complaints whatsoever with how it all operated and worked.
You've broken a lot of boundaries over your life so far. So I know you were previously Minister for Sport, and then I think in 2018 that role was included to loneliness. So I never heard of Minister for Loneliness, if you can call it that, until I started doing a little bit of reading about you. But obviously, a lot of people with cancer have spent most of last year shielding. They've been labelled clinically extremely vulnerable, which is a term that I think stirs up a lot of fear, a lot of resentment amongst people. It's been really hard watching kind of from the other side of the fence, people go through cancer treatment on their own, and some of the fear. I remember talking to a young mum who'd finished her treatment and she was too scared to take her kids to the park. So as COVID kind of eases and vaccination kind of increases and the restrictions ease, how do you think that we can help those people who have been cut off socially for so long, either because of a chronic condition or their age, or purely just because of fear? How do you think we can help them not be scared to start becoming social again?
So I think there needs to be some peer support groups so people can help each other reduce the anxiety. And I mean, I'm a dreadful advert for clinically extremely vulnerable because I have not behaved like I should have. Sort of kind of, I haven't been irresponsible. I mean, I haven't been going around hugging strangers or, touching people, but I have still gone to the supermarket. I have still taken my 5-year-old to school every day. So, my other half has still gone to work because we've just taken an attitude of kind of just getting on with life. But I do recognise that there are still, huge anxieties among people who have been better at shielding than me. And it is about helping and supporting those people to reintegrate themselves back into society. My mum is one of those. She doesn't have cancer. She has COPD. So she too is CEV. And she's incredibly nervous. And until she had her first vaccination, we were in a bubble with her, but she was quite nervous about the fact that my son was still attending school. And things like that, and those nerves have got better since she's had her jab, but I can understand why people are anxious. She won't go to the shops or the pharmacy unless there is no alternative. But I get that. But helping people, having when we're allowed the rule of 6, having which is only in a couple of weeks' time, having coffee meetings and going out and sitting down together and physically leaving your house. I mean, it comes to something when the most exciting part of your week is going to chemo, where you actually get to talk to people.
But even that's normally can be quite a social occasion for patients, and a lot of my patients who've been having treatment for a long time, they say it used to be great because we'd see our friends there, and now we're called from our car as soon as it's ready, we're whizzed up, there's no waiting room, we're sent. I mean, it's much more efficient, but it's really antisocial. Cancer's been I think, and maybe I'm wrong, I haven't been through it, but watching it, it feels like it's been incredibly lonely.
I think it depends on your mindset there, because I mean, I haven't resented not having someone else with me,
Okay.
because I think I'd be worrying about them.
Interesting.
And so, I mean, we had a very good friend who sadly did pass away from cancer. Have treatment in the same ward that I've been having mine, and his partner, we used to go with him and sit there all day with him and everything else. And I, to be honest with you, I couldn't think of anything better than having my other half sat with me all day. So I kind of used it as an opportunity to just zone out and not be with my other half and the 5-year-old who I've been locked in with all this time. So this was kind of me time, which sounds bizarre.
No, it's not, it doesn't sound bizarre. I think everyone's different. Everyone's got their own experience. I guess it depends a bit whether you're having inpatient or outpatient treatment. You've had a chemo buddy, or you've got a chemo buddy, or you're helping other people.
Various, well, but all of those things.
Everything.
All of those things. So one of the girls I played football with, she had breast cancer a few years ago. So she had been giving me great advice on some of the sort of kind of unexpected things that happen, like severe constipation and so on. It's always nice to talk to someone, about dry vaginas.
But that's all the bit that doctors would never bring up. But, well, you'd be lucky if they did.
Exactly. I'm not sure I would be able to kind of take it from, my male oncologist either. It's kind of that she's been around for me, but I'm also on a WhatsApp group of other people that have either been through it or going through it, or at different stages of it from the unit that I'm in. There's, again, it's an opportunity to talk to people, to talk to the people that, personal things like not having sex, hairs growing back on your chin. It's like, why has this annoyed me so much? And stuff like that. So I have taken the learnings that I've had from people to be able to support me, to support other people. And there are other people in my constituency and also beyond who've got in touch and have just sort of kind of, welcomed the opportunity to chat. And also a man, actually, I'm a buddy with a man, and we were on exactly the same chemo cycle. So we were able to talk to each other after our Thursday chemo sessions. And I actually feel more strongly about how lonely it must be for a man to be going through breast cancer treatment, with all the pink literature and no one to talk to, so it's been a sort of kind of interesting journey.
And I think that's one of the things that we when our groups are running and they're running well and people get to know each other, it's one of the really positive things that can come out of it, is that peer support, but not just in a coffee room around a cracked cup of tea with soggy digestives, where people are out there, they're doing something, they're having fun, but they can also talk about the bits that perhaps someone who hasn't had cancer just wouldn't understand. I think I've heard you talk very positively about the care you've received over the last year, obviously during the pandemic as well. Now you've had first-hand experience of NHS cancer services as a patient. What are the things that you think are missing, the things that we could do better and should do better?
I think it's a postcode lottery around care. And I mean, so the trust that I am in hasn't stopped any of its cancer services throughout the pandemic. I only have to open a newspaper to see that that's not the case across the country. I find that sad, because I've had wonderful treatment. There's not been any interruption to that treatment. Yes, there's been changes in terms of, not necessarily having face-to-face consultations with your oncologist, but, I think that's become a way of life in many different ways. So, that's not something that I'm particularly fussed about. But I think we need to have a much more kind of universal kind of service, so that actually you don't have stories about people not getting their screenings and, diagnosis being too late and so on. I think, one of the trusts in Kent does have like a one-stop shop for diagnostics. So you can go in and see a consultant, have an ultrasound, have a mammogram, have a biopsy, all within the same appointment, effectively. That's not the same in my own trust, where I had that done, but I had it done privately. So again, it's not having that kind of universal service. But I don't have any complaints in terms of the treatment. Although actually, again, this is the other universal aspect of it. My trust is using the fast forward approach in radiotherapy. So I had 5 doses of intense radiotherapy. 2 of my friends, 2 buddies, and a man and another woman that I'm buddies with, are in different trusts, and they've had 15 doses of obviously lesser radiation or whatever it is. But I've had limited side effects in terms of burnt skin and all the other things that happen in radiotherapy, whereas they're in agony, and in pain because of the 15 doses of radiotherapy. And I'm just like, well, I'm getting exactly the same, but in 5 days. So why is it so different? Why are we making breast cancer patients or whoever go through 15 days of disruption when you can have the same outcome for 5? So I kind of sit there and think that we need to have a more uniform approach to some of these things.
So we had so I work in Nottingham, and in the East Midlands, we had at our multidisciplinary team meetings, there were some hospitals who had to stop all palliative treatment, and in Nottingham we could continue. And it just seemed ridiculous that depending on which boundary you lived in, you were going to be offered chemo or not offered chemo. Obviously that was an extreme time. What about aftercare when you finished your cancer treatment? Do you think, because this is I guess for me part of why I wanted to create 5K Your Way, do you think that's something that we could do better when people finish their treatment?
Well, I'm only at the beginning of my aftercare, so it's difficult to answer that question right now. But I am, we have a counselling service through oncology in the trust that I'm in, and I have been referred to that, and I have my first counselling treatment tomorrow, because, as somebody who, and again, I think it depends on what kind of cancer you have. And my problem is not my physical health; it's my mental health. And my cancer was cut out, right? So it was gone. And the chemotherapy and the radiotherapy and the hormone treatment are now about making sure it doesn't come back. And I can't get my head around that, because I'm if you do A, B happens kind of girl. And therefore, not knowing if B is going to happen or not is something that I'm finding really challenging. And I don't want to live my life in fear of either a recurrence or some kind of secondary cancer. And so, counselling is going to, I hope, help with that. And I've got to sign up to the Moving On course from Breast Cancer Now. But I think that's where the peer groups can also help. Also, they can not help as well, because,
of course.
One of my wonderful WhatsApp groups that I'm on, sadly people are facing secondary cancer and in really quite desperate circumstances. And although I keep on trying to remind myself of the statistics, actually, you sit there and think, well, it can happen to them, it can happen to me, or actually worse, it will happen to me, which is the kind of place I'm in at the moment. So I just got to also remember that by keeping myself physically well, eating well, reducing stress levels, I'm in the same percentage category as everybody else in the country, in terms of, cancer occurring in the next 10 years. So, that's the hardest bit. That's been the hardest bit for me, is the bit after treatment. Everything beforehand, I was just doing as I was told. Now it's kind of like, well, see ya. Off you go.
I think that's one of my close friends actually had cancer, and it was really interesting from a professional point of view going through it with him. and seeing actually he was okay when he was on treatment. Yeah, physically it was really hard, but it was the aftermath when he, like you, he was, chances are he's cured, but that aftermath of dealing what he's been through. It's great you've been offered counselling, because I think that is far from universal across the NHS. We're running out of time, Tracey. I think you are an incredible advocate. And has it been hard sharing your story publicly, going through it in the public?
Not really. In part because I live in my my own constituency, and because we're so visible in where we live, and we live in a small community. Well, it's not actually that small community, but people know me and know who I am, and it was obvious that I was going to be going through this in public because constituents are using the same oncology services as me. So I'm sat in the same chemo ward as people that shop in the same supermarket. So there was an element of not really having a choice, but at the same time I did kind of want to destigmatize a bit of it as well. And I'm just fortunate in that my side effects have enabled me to show the good side, if you like, of going through chemo. I think I still would have done the same even if I looked on everything else, but yeah, I mean, I've managed to work, and I think that's the thing, is actually a lot of people are out there going through this right now who are still getting on with their lives as they were before, and yet I think probably we don't think that. Well, that's not, somehow our brain is conditioned to think that we all stop functioning for 9 months or whatever it is that people are going through.
Well, you're helping counteract that. So 2 questions. You've said you're going to max out on life. How are you going to do that?
Actually, I'm just going to enjoy things, I think, a bit more. I mean, I know it sounds a bit airy-fairy about mindfulness and everything else, but I do, apart from the need for the counselling around the fear, I am trying to sort of kind of live in the moment and just enjoy every day for what it brings. And there are certain things that I would like to do, I actually, which might be considered luxurious or too expensive or unnecessary, but actually I just kind of think, well, why shouldn't I? Why shouldn't I do that? So that's the sort of kind of thing, and I want to be around to see my son grow up, so actually I'm quite enjoying eating really healthy. Sort of, I've got a mix of meat and vegetarian vegan diet going on at the moment, so
a meat and vegan diet, I like that.
No, I'm not fully vegan. I couldn't possibly cut out, well, I'm not fully vegetarian, I couldn't cut out meat, and I could never cut out cheese and milk, but actually having a couple of days vegan a week is, I think, really good, and it's made me feel a lot better.
I've discovered the most incredible recipe book, the green roasting tin. You basically, everything takes 10 minutes. You bang it in the oven for an hour. I'm not a cook, but it's so easy. It makes you try different stuff. Definitely worth £10.
Right, I'm going on Amazon immediately.
Green roasting tin. Tracey, thank you very much. We would love you to join our a 5K Your Way group one day. I will let you know where they are. Hopefully, if we believe Boris, we'll be back at the end of June. So fingers crossed. Thank you so much for joining us and giving up your time.
Thank you for having me.